Hey there! Today, we're going to talk about a topic that has intrigued humanity since the beginning of time. How do you get pregnant? For starters, let's start with some biology basics. Pregnancy occurs when a sperm cell from a male fertilizes an egg cell from a female. This fertilized egg then implants itself into the uterus, where it begins to grow and develop into a fetus. But, how does this process happen? Well, it all starts with ovulation. Ovulation is when a woman's body releases an egg from her ovaries, which then travels down the fallopian tube toward the uterus. During this time, if sperm is present in the fallopian tube, they can fertilize the egg. Sperm can survive in the female reproductive system for up to 5 days, so even if you have sex a few days before ovulation, there's still a chance for pregnancy. Once the egg is fertilized, it becomes a zygote, which starts to divide and grow rapidly. Within a few days, it becomes a blastocyst, which is a ball of cells with a fluid-filled cavity in the middle. The blastocyst then travels down the fallopian tube towards the uterus, where it will implant itself into the uterine lining. This is called implantation, and it usually happens about 6 to 10 days after fertilization. After implantation, the blastocyst continues to grow and develop, and it's officially considered an embryo. At this point, it starts to secrete a hormone called human chorionic gonadotropin, HCG, which is what pregnancy tests detect. Now, let's talk about the first few weeks of pregnancy. The first few weeks of pregnancy are a truly incredible and awe-inspiring time. From the moment of fertilization, the tiny cluster of cells that will one day become a baby starts to develop and grow at an astonishing rate. One of the earliest stages of development is the formation of the blastocyst. This tiny ball of cells contains all the genetic information needed to create a human being, and it's the starting point for all the amazing changes that will occur over the next 9 months. As the blastocyst begins to grow and divide, it starts to form the amniotic sac. This fluid-filled sac will eventually surround and protect the developing fetus, cushioning it from any bumps or jolts that might occur. It's like a tiny little bubble of safety that will keep the growing baby snug and secure. Another critical development that occurs during the first few weeks of pregnancy is the formation of the placenta. This remarkable organ will provide the growing baby with all the nutrients and oxygen it needs to thrive, as well as remove waste products and help to regulate the baby's temperature. Despite all these incredible changes, however, the embryo is still incredibly vulnerable during the first weeks of pregnancy. Pregnant individuals need to take care of their health and avoid any substances that could harm the developing embryo. This includes things like alcohol, drugs, and certain medications that can hurt the delicate growing baby. Overall, the first weeks of pregnancy are a time of rapid and miraculous change. From the formation of the blastocyst to the development of the amniotic sac and placenta, the tiny cluster of cells that will eventually become a baby is truly a wonder to behold. Despite the vulnerability of the embryo during this time, it's also a time of incredible hope and possibility, as a new life begins to take shape within the womb. Pregnancy is one of the most exciting and life-changing experiences that anyone can go through, and one of the earliest signs of pregnancy is a missed period. For those who are trying to conceive, that missed period can be a moment of incredible hope and anticipation, signaling the possibility of a new life beginning to grow. But a missed period is just the beginning of the signs of pregnancy. As the weeks go on, many people may experience morning sickness, a feeling of nausea and vomiting that can strike at any time of day. Despite the name, morning sickness is not limited to the morning hours and can persist throughout the day and night. Another common sign of pregnancy is breast changes. As the body prepares for the arrival of a new baby, the breasts may become swollen, tender, and sore to the touch. This is due to the hormonal changes taking place in the body, and it's a clear signal that something big is happening. Fatigue is also a common symptom of early pregnancy. Many people find themselves feeling tired and run down, even if they're getting plenty of rest. This is also due to the changes taking place in the body, as the body works overtime to support the growth and development of the new baby. All of these signs of pregnancy can be both exciting and challenging, as those who are expecting a new baby navigate the ups and downs of this incredible journey. While the missed period, morning sickness, breast changes, and fatigue can be uncomfortable, they're also a reminder of the incredible miracle taking place within the body. As the weeks and months go on, the signs of pregnancy will continue to evolve, but the sense of wonder and amazement will remain. What are your thoughts on this? Let us know in the comment section below. Thanks for watching.